Kiro, give me a sense. How bad is it in the pharmacy right now?
So this is the worst that I've seen in my career in terms of shortage and respiratory illness in children. I would like to add to the point that you said that there's a shortage of Tylenol as well as Advil. There's a shortage of two things that are extremely difficult for us to manipulate or make. And these are the two most commonly dispensed antibiotics for kids, amoxicillin and azithromycin. And not enough is being said about those. If we cannot treat children in a community setting, this is going to spell a larger disaster for hospitals, as hard as that is to even imagine. So this needs to be addressed as well. I'm really not sure at what point do we refer to this as an emergency? At what point do we have our politicians actually address this in a more urgent fashion? This is a big deal. This is a huge problem. Children are suffering and parents are understandably very frantic.
Kiro, there's a lot I want to pull apart there, but then let's dive in, because you've made such a point of saying those two antibiotics that are no longer in vast supply. Talk to me about what they're used for. What happens if children don't have access to them? Paint a picture for us.
So these two antibiotics are broad spectrum antibiotics. They're used for a variety of infections, everything from ear infections to chest infections. They are basically the go-tos for most physicians to prescribe when it comes to kids. And they went on back order about a week ago, and there is no news about when they're coming back. So this is not being addressed, and I'm not sure why the news is just talking about the Tylenol and the Advil. We're able to mitigate these, we're able to manipulate these, we're able to compound these. When it comes to azithromycin, it is extremely difficult for a pharmacy to compound this. It is extremely difficult for a pharmacy to compound amoxicillin. These are two antibiotics that I don't know of another country in the world that is suffering from a shortage for, but we are here in Canada. And I think that Health Canada needs to answer some questions. I don't know what's going on. I really can't explain why the shortage, as much as they would like to attribute this solely to increase in demand. I think that this is nonsense, because supply should have caught up at some point, and other countries don't have this issue. Did they sell this to another country at some point, like they did with PPE back in February of 2020? Did they just completely have no foresight into what was going to happen this season? Masking, it's literally a no-brainer, but I don't know what governments are trying to appease here, or who they're trying to appease by not reinstating them, at least in schools, so we can stagger this. I have a lot of questions, but nobody's answering this. This is not being treated even close to the urgency that it should be treated in.
Why is that, Kiro? Because I mean, you're putting such a fine point on it. And I have to say, I've never heard anyone speak with this degree of urgency. So if you see the urgency, and I imagine your colleagues do as well, what is the response you're getting from Health Canada? Who is it that you turn to and say, hey, we need this stuff, we're not getting it? What are the answers that you're getting?
So it's very easy for someone to give a diplomatic, calm response to us when they don't have boots on the ground, where they're not sitting here dealing with parents crying in a pharmacy. You know, they're hearing children screaming over the phone. 39.8 degree fever for 6 days. If that's not your kid, you don't care. And that's exactly what politicians are at the end of the day. That's what it appears like to me, that they don't have their hand in the fire, and so they don't really see it. We saw this all across the pandemic. You saw this with PPE, when we had pharmacists had to go to work with no PPE, and then we find out that it was sold a month prior to lockdown. We saw this with rapid tests when last Christmas, when they were being sold for $200 on the black market because our government just didn't buy any. Okay, nothing shocks me anymore, but I would really like some answers. I would really like this to be treated with some urgency, because it is an emergency, and it's going to get worse if we are not able to deal with these patients in community, because then they have to go to hospital. And hospitals are crippled right now, as you've already noted.
You mentioned the parents that come to you and they're crying and they've got sick kids. Can you give me a sense of the desperation you're seeing?
The desperation I'm seeing is the understandable desperation of any parent with a child that is sick and they're unable to provide them with medication, very basic medication. I'm a parent. Any parent that's out there will agree. There is nothing more important than your children. How could someone not sympathize with this? If a society is not able to protect its children, if it's not able to provide for its children, then start all over. You're done. That's the basic minimum that you need. Cancel your trips abroad, cancel all your meetings and dinners. There is nothing more important than your kids right now. And not even remotely is being done enough for this crisis. And it is a crisis, and it is an emergency.
I hear so much emotion in your voice, Kiro. Are you angry? Are you scared? What's your fear right now?
My fear right now is that we start to hear about fatalities in pediatric population. And I think that that's right around the corner at this point. If you have that many kids on ventilators at children's hospitals, I don't want to see any more of this. I want to stagger this. I want to slow this down ASAP. I have my boots on the ground. I see it. I see it coming. And anyone working in hospital right now, listen to these people, okay? Nothing was done to increase capacity. We have a shortage of pharmacists. Did you know that? Right now, we've had more pharmacists quit and retire, and our examining board has decided to fail more pharmacists than ever before. We have a shortage of pharmacists. So you could imagine how bad it is in nursing. Nothing was done to increase capacity, as mentioned by the fellow before me. So you've had 3 years to get this right. Governments have failed miserably. You have increased demand more than ever and the lowest supply in healthcare professionals on record. So I don't understand how we're not using all of our resources all at once to fix this. And quite frankly, all my colleagues across the globe don't understand either.
What do you mean? When you say your colleagues across the globe, what do you mean?
Oh, I mean that I have colleagues in India, in Egypt, in China, all across Europe, and they don't understand how Tylenol is not available in liquid form in Canada. I have colleagues in developing countries that don't understand how we don't have amoxicillin suspensions. And quite frankly, I don't understand either.
Well, when they say that to you, Kiro, when they say, hey, man, Canada's a rich country, why do we have this stuff and you don't? What do you tell them?
Silence. What can I tell them? What can I tell them? You tell me, okay? It's humiliating. So we don't manufacture? I don't know. We don't manufacture. We probably sold it to another country sometime in July. I don't know if anybody's asking that question because we seem to have a track record of doing this with urgent life-saving devices and medications. So I don't know.
Well, Kiro, I will say that we have consistently put in calls to Health Canada, to the various ministers of health. We'll continue to do that, and we'll put some of your questions to them. Whether they'll come on or not, we don't know. We are always willing to have them on. But in the meantime, I really want to thank you for your time and for your insights, and wish you luck.
Privileged to help. Thank you so much.
Kiro Massa is the pharmacist and owner of Lawler Pharmacy in Toronto.